Good morning, everybody, and welcome to the first session of the second day. And I have great pleasure in, I don't know whether I should use the word introducing, because I don't think Sir requires any kind of introduction here in this August gathering. So I am going to do away with the formal introduction because I guess all of us know him very well. I just would like to say that his name says it all. Dr. Amdekar, A for academic. His thirst for excelling in academics has always been there. M for model, which he has been for all of us to try and emulate. D for doyen of pediatrics, adored by generations of his students. E for education, that he loves to impart with the innumerable talks he has given in so many conferences and meets. K for knowledge, of which you'll all agree he's a storehouse. A for articulate. His proficiency as a speaker has long become legendary. R for responsible, that he has been for molding so many of us to practice rationally. So with this, I think this is enough to introduce you, sir. Thank you so much. And please, we'll have your talk.
Well, at the outset, thank you very much, the organizers, Suhas and Dr. Parmanand. I'm overwhelmed by the love and affection that I get from all of you. Dr. Gopal and the friends, thank you very much for this. I think when Suhas gave this title to me, I started wondering, what does this mean, riding the waves, changing trends and experience? I had to really look at what really it means finally, and therefore I thought that, well, we have gone through waves. Waves come and go. And what are these? We possibly develop some attraction towards new things. That's a wave. And after some time it passes off, and by then some new attraction keeps on coming. And I think if we look at the modern science with advancing technology, it is exactly that, attractive and exciting, as against a mundane, traditional art of practice. And no wonder we have gone through waves up and down, and by the time I come down after the first wave, there is a second wave coming. And I think everywhere people talk, change is the only constant. And Bhagavad Gita says the same. I wonder whether it is true at all, because we know that science of medicine has changed, but the uncertainty has remained the same. So where is the change and uncertainty? And I think the traditional art of practice has stayed. There is no change, but we have changed. So some things have changed and some things have remained constant. I don't believe that change is the constant all the time. Well, knowledge has been increasing, that's a change, but the ignorance is same. Then where is the change as the constant? And I think finally when he asked me to talk of experience, I thought, what is experience? Experience is achieving perfection with repeated practice. Have any one of us arrived at that kind of perfection? No. We are all practicing doctors. That means still not perfect. Where is the experience? And I think therefore with this kind of introduction, you will have to take, not with a pinch of salt, but a tablespoon of salt of what I am going to say. I am sure there would be a lot of debates on that, but one thing is certain, that the changing trends has been a challenge to the trained person. Because I have to learn, then unlearn and relearn again. I don't know what I am learning today is going to be obsolete tomorrow, and then tomorrow I would have felt, why the hell I learned that yesterday? Now this is where we go on learning forever. I think there has been a general observation about what trends have been changing. The focus has shifted from health to disease, and health promotion has been our issue. But we are not health providers, we are now disease managers. How many of us advise on health to our patients? We only treat the disease for which they come. And I think this is the definite change. earlier generation had a focus on mind and the body both. Over time, we only look at the body, and I think we know today that the mind is involved in every disease, and more so, it's the most important part in the recovery from a disease. And I think therefore the mind could be a best asset for all of us to use, or it could be a best enemy when you don't look at that. And I think earlier generation had a strong basics because there was not much of advance. Now we have a lot of advance, but we lack on basics. So possibly again, we are going somewhere astray, and we want to be very sure that this is what exactly we have seen going about. Well, earlier days there was a less intervention. Thereafter, we have now so much of more interventions, and we have misused them. And now again, we feel less is more. The neonatologists who treat the preterm babies tell me that less is more. And now they like not to even touch the baby, but just observe from a difference. Because they know that moment you touch the baby, the heart rate goes up and down, the blood pressure varies. And I think that is detrimental. To that extent, from where have we come? So now interventions are good, but if less is more, we need to learn where not to intervene. And I think today the indications of CT scan or MRI are many, but where you should not do is the issue that each one of us may have to think for varieties of reasons, not only medical, social, economic, whatever. And I think earlier it was an experience based because there was no concept of evidence. Thereafter, evidence based came in. And what was evidence based? The random trials, controlled trials. Now, when the trials are conducted in a controlled environment, you and me work in an uncontrolled environment. What does that controlled trial means to me? Random controlled trial, double blind. Who is blind? The patient is blind, the doctor is blind. And I think today we know that evidence has also different grades. And the last grade of evidence is an anecdotal experience. That means we are going to call anything as evidence if the anecdotal experience is an evidence of grade 5. That means everything is evidence. We are back on to experience. And really, experience and evidence are the two sides of the same coin. After all, evidence is based on experience and then proved. So you can't have evidence without experience. Well, we fine-tune that experience, and again, evidence is not likely to be used for every individual patient. It is a generalization. And each one of us will have to fine-tune that evidence to suit our given situation. Therefore, there are lots of problems of evidence. And now what has happened? We are evidence burdened. Every time I say something, they say, "Sir, do you have an evidence?" And I'm sure that evidence is always easy to find out. Because somewhere or the other, I remember, some of you may have heard it, that I showed a cow to an intern and asked him, "What is this?" He said, "It's cow." I asked the MD. He said, "Looks like cow, but you must confirm it by tests." And then I showed it to DM. He said, "There are many possibilities." I said, "What is the possibility?" He said, "It could be hypertrophied goat." I said, "What the hell are you talking?" He said, "I'll show you a Lancet, one report." I was amazed to see that report. Yes, you could have missed the cow for that. I said, "What else?" He said, "Atrophied elephant." Again he showed me an article. I was amazed to see that. After doing many tests, when they were negative, I said, "What next?" He said, "It must be cow." What is the inference? For common things, the intern was much confident and better. But as we started getting more and more knowledge, we thought that we must have an evidence of everything. And I wonder, the birth and the death does not need evidence. You go clinically and announce somebody is dead. You just look at his pupils. Okay, and you say he's dead. Nobody says you must have an evidence of death, and so also the birth. How funny. At the end of the life and beginning of life, you don't need evidence, but in between, everywhere you need evidence. We are evidence burdened, but yes, evidence is required. But we all know that absence of evidence is not lack of evidence. So there are many, many gray areas in science, and everywhere we have the same issue that we face. I just look at what has changed in the management, and I feel very little has changed. And I thought I can sum up management in 3 P's: either palliative treatment, or a placebo, or a plumbing, that is surgical. Have we cured anything? The only thing that we cured was infections, and today even that has become a difficult thing. Earlier days with streptomycin, isoniazid, and even ethambutol and simple drugs, I was confident that the TB will be cured. Now with many other drugs, I need to tell a patient mostly you will be cured but may not be. Where have we gone to? That means we have improved, but we have still a lot of ignorance. We are able to do many things today, but we are not able to cure them. The surgeons can cure your defect, but they have not studied what was the cause of that defect, what was the genesis of that defect. And we have so much of ignorance, so we are improving the quality of life, maybe, but quantity of life certainly. Surely the life is much longer now, but that may not be that the life is also better quality. And I think these are the issues that I thought in general you have many of these things. I think what is the science going to? I think it's a reductionist science. The medicine has become reductionist. What does it mean? We want to go to the cellular level, and even not even a cellular but a micro part of the cellular level. Worth knowing that every cell in the body is going to work in coordination with each other, and looking at one cell and one small part of the cell may not tell the whole story, because all other cells are also joining hands to get out of the trouble. So are we doing the right thing by going into the small part of the cell and possibly ignoring how the other cells are going to also influence the working of that cell? That is what is called as the reductionist science. While we call it an advance, that we can even get into that microscopic cell, we have forgotten that the rest of the cells of that organ are also joining hands to do that. And I think when you are opening a cork of a bottle which is very tight, you almost make every muscles of your face also work. That means even they help you to kind of open the cork. They may not do it directly, but certainly indirectly they push you to use the best force. You can imagine how a distant cell also helps the action of that. And I think this reductionist science may not be taking us to a right path, so we hope that we are going into finding something, but that could be useful maybe a century later, but possibly not today. I think I was amazed to see one author recently putting up that the greatest discovery of this present century is the discovery of human ignorance. And I looked at that and I said, yes, as we know more and more, and you have heard possibly in autobiography of many scientists, everyone has said that as I started knowing more and more, I realized I know less and less. If the big scientists say that, who are we to say that we understand everything? But we profess to start understanding everything, though really in our heart we know that we have not understood many things. And I think if I come back now to specific changing trends in science that I have seen, then I think the first thing I have realized that every disease manifests as an interaction between the host, the environment, and also the pathogen. So tripartite interaction. No wonder that each disease is presenting with varied symptoms, and we call it an atypical, we call it incomplete, for varieties of reasons. I remember when I was trained, malaria was simple to diagnose. Somebody came with rigors and we knew he had a malaria. Then we realized that rigors can be of anybody's people. And the malaria started coming without rigors. And I recall about 20 years ago when I was in Surat, when that city was pretty unhygienic. Now it's totally changed. And every person staying in that city has had multiple times of malaria, not once. And I was talking about this kind of issue, and I said, today malaria can come with low-grade fever, high-grade fever, continuous fever, intermittent fever, any kind of fever. And one of the delegates raised his finger, and I said, yes, what do you have to say? He said, sir, in Surat, malaria has started coming without fever. Now, I realized that malaria coming without fever, then all of us have without fever, so do we have malaria? Now, that's the challenge. Who is this fellow? I asked him, how do you diagnose him? He said, just a little anorexia, little not feeling well. You do a peripheral smear, you give chloroquine, Vivax is gone. What a change. And it's no surprise. And today you know that every disease is manifesting so differently that it has been the biggest challenge, and the parents of our children who come to us wonder why you are experienced but you can't make out what's the problem. Because it is so now complicated. And I think earlier the infection was the killer, when antibiotics were not there. But remember when Fleming invented penicillin, he right at that time said that this is not the antibiotic which can take care of everything, because the germs will have an inherent, already existing, resistance to penicillin. The man who invented knew the limitations of his new invention. If he knew that, today we are absolutely seeing not only the inherent ability for the bacteria to get resistant to our new armamentarium, but we have further helped them. And now we know that the germs and the bacteria came much before human beings came on the earth. The earth belongs to them. We are intruders, and we scientists say, oh, there is an intruder organism, so we must kill him. How can they allow us to kill them at all? It's impossible. Even with advances, we will have that. And therefore, today we have the infections which are not easy to control. So, where are we going from? We have had new infections, but we have old infections coming in a newer way. So again, we have many lifestyle diseases, and we know that we have a dual malnutrition. 50% are undernourished, 30% are obese, and only 20% are normal. And I learned that out of those 20% normal children, majority of them are micronutrient deficient. And all kinds of micronutrients. You name that, we know that iron and vitamins and all that, but copper and selenium and whatnot. Then who is normal today? Mostly I am normal, so I am called the best normal. Almost like honesty. Which one of us is honest? Nobody. But if I am a little dishonest, that means largely honest, they say, what an honest person you are. So the definition of honesty is changed, and a little dishonesty is acceptable as a part of good honesty. We have changed. I think we have so many newer diseases. We have a GARD. When I was being trained, there was only GAR. I'm sure the D gang was not known though at that time. Now the D came. And now we don't know who doesn't have D or who has D. And can we be sure? No. I was told, oh, it's simple, do a barium. They said barium is useless. You must do an esophageal biopsy. I wonder, how can a biopsy say what's the cause of inflammation? But they said, yes, it does. Then they said 24 hours pH. Thereafter they said, but the non-acidic reflux may be missed. That means every new investigation, and today we do not know how to definitely label GRD. So this is the issue. Same thing about everything. When CF came to know, Okay, we said that, oh, now we have a molecular diagnosis and we have a delta 508 and diagnosis is done. By the time we learned that, there were hundreds of mutations and every time the report came, a negative report does not rule out, correlate clinically. Now today every lab report says that, every radiologist says that. My colleague tells the radiologist when he writes, correlate clinically, he tells them don't confuse radiologically. So I think each one is passing a buck to the others. That means all of us are equally ignorant. Look at all that. IBD, Kawasaki, immune deficiency, IM, genetic. We have but have we understood them totally? No. We have so much of ignorance about everything. We don't know why Kawasaki arises at all. And we now know that it's an atypical Kawasaki, incomplete Kawasaki. I'm sure next year there will be Kawasaki but no Kawasaki. So how will I go about that? Okay, that means again a clinical story. Immune deficiencies, yes, we have further progressed in understanding that, and I'm sure that some of them are even curable with the transplant, etc. We have not yet understood what would the transplant do over time. There are a lot of other issues concerned also about the many issues might come in over time, but I'm sure that we have progressed. And I just saw 2 days back in the Times of India big advertisement that one of the corporate hospitals in Mumbai, the person has done 150 heart transplants. Oh, what a great advance. Okay. Now we will slowly know what all problems it causes, and besides who can afford it, etc. We have advanced. There is no doubt at all. But with the advance, the ignorance also is advancing side by side, and we seem to be always lagging behind in the ultimate success, and I think that is what happened. Well, we have improved in genetics, and I know that today we have a geneticist also. But when the breast cancer gene was invented, and people knew that yes, this is the gene, and if you are a gene positive, you have a risk of breast cancer. This was about 10-15 years ago. And in the United States, every lady 40-45-year-old would opt for the genetic test, and then it became necessary for the FDA in USA to format an information that a person should get before getting onto a test. And they made it mandatory. And that information said that the test may be positive, but you may not get breast cancer. The test may be negative, you may still get breast cancer. Now, when a layman reads that, he says, but then what's the idea? No, mostly yes, mostly no. Thereafter it says, if you are gene positive for breast cancer, then your doctor might ask you to get rid of both ovaries and both breasts. That's another shock at a 40-year-old woman. And then if you don't want, then you have to have every year a check. Then it further says that you checked yourself today, but your problem may start tomorrow, but you will come after a year for the next test. So you may be late in diagnosis. My God. Finally it says that at the end of all that, some of you may get depressed. Oh, just before breast cancer I get depressed. And lastly it says, occasionally there may be a suicide tendency. I called it a genetic terrorism. Okay, it's better I don't want to know whether there is a breast milk cancer or not. I am exaggerating, I am aware of it. I know that there are. But look at the genetic tests that we have. None of them can 100% say yes or no. It can only give you a thing. Our astrologers did the same, no? And we laughed at them. Today the lay people must be laughing at us. That is all the difference, but the ignorance still lasts. We'll look at the diagnostic modalities. They are changed so much. But which test is 100% right? Hardly any. You talk about sensitivity and specificity, there is no test which is 100% sensitive and specific. That means every time there are limitations and challenges. Look at what happened. When I was trained, ESR was the only one, and they said don't do ESR, it's only for prognosis. It's not for diagnosis. Then we said CRP, because CRP comes within 4 hours. Damn, ESR took another 24, 48 hours. You were in a hurry, so you did CRP. And you said CRP is a good. Today we use CRP very well. By the time we did CRP and ESR, today we know that we need to do both. Because some conditions are CRP increased, but not ESR, yes. So we will be forced to do both. By the time I learned it, procalcitonin came in. And they said, oh, CRP takes 4 hours, procalcitonin in half an hour. Oh, I thought the next test would tell me that the disease has come to your neighbor, start wondering. We are in a hurry. Okay. And I realized, I read just about a month ago, there is an enzyme called TRAIL, which comes up even earlier than procalcitonin. And it has one more advantage. It is upregulated in viral infections and downregulated in bacterial infection. Wonderful. Okay. We will know how bad it is only when we start using it. People thought I was good. When many people started using me, they also knew I was not so good. So, I think more use also makes us understand many, many things. I've already said about this management issues. Well, earlier there was a personalized treatment. I remember my father, who was a family physician, would concoct a different cough syrups every time. And he knew that the person would possibly get better with this combination, but not that. How did he know? Just by experience. Then we came for a regular cough syrup once for all. And then the industry was very clever. They said we have put expectorant, sedative, antihistaminic, mucolytic, everything. One of them will work, don't worry, don't think, okay, don't waste time. They provided all that, okay. Now is the era again for the personalized treatment. I was amazed to see that the chemotherapists, the cancer people have started now looking at a gene where which of the drug would act the best against that cancer in that patient. Oh, we are coming back to personalized medicine. But we have taken a long road. I remember there was a village, a small village, where a person would go to the sea and catch some fish and sell it in the market, and the rest of the day enjoy, in the evening have his drink, and he had a good life. A highly trained person came to that village and said, you are wasting your time. He said, why? He said, you are working for 1 hour and wasting doing nothing. He said, what do you want me to do? He said, go to the sea whole day, get more fish, get more money. He said, then what do I do? He said, then you employ people under you, get more fish. Then what do I do? Get a trailer and have more fish and export it. Then he said, then what? Then after 30, 40 years of hard work, you just have a good house and enjoy life. He said, sir, I am doing it right now without doing anything. Why are you trying to tell me he's a management expert? Look at the fun. I think we need to know where we are and how much we need to go. Earlier there were home remedies. They were low cost. Okay. Then we came to high cost polytherapy. Now we are going back to traditional use. With the pandemic recent, what we are trying to say? No, the mask, wash your hands, sanitizer. Oh, those my grandparents and their parents also knew. In between we thought we don't need to do that. We have powerful antibiotic. Now we are back to traditional use. In US and the Western Europe, you have a yoga institute for a treatment of asthma now. And your grandfather knew it. In between we did not know. And now you use it back again. How the science has been changing one after another. Earlier there was a universal prevention. You have a good lifestyle, you have a good nutrition, you exercise, and you are mostly prevented from infections and diseases. In between we fired off all that, and we have a selective typhoid vaccine only against typhoid, not against Shigella dysentery. Okay, whereas the hygiene would have presented everything. I'm not against the vaccine. That is certainly a definite prevention, but that does not mean that you get away from the tradition. So here is a situation where you carry on the traditional ways and add on the benefits of the modern medicine, but unfortunately we have started feeling that it's one or the other and the old one is no more now, the new one is coming. I think we have to take the best of the old and add the new to that, and I think that is where it is. Some parts of the art of practice has also changed. Earlier generation used a detailed history, a thorough physical examination, diagnosis based on art of probability. 125 years ago, it was said that medical science is a science of uncertainty. William Osler said that. And the art of probability. How true it is. He knew it that time. He was the first physician who took his students to the bedside. Till then it was only in the lecture hall. But he said that science of uncertainty and the art of probability. How true it is. And earlier people knew that. Therefore they used a lot of communication, counseling, empathy, ethics, transparency. They were treating not the patient but the whole family. And what happened then? I think the result was a holistic care. And what is holistic care? Using body, heart, mind and soul. Where is this applied to clinical medicine? Body is knowledge. Therefore there is no doubt we must go on learning and learning. We must have a lot of knowledge. But we must have a heart, that is compassion. We must have a mind, that is commitment. And finally, you are answerable to your soul, that means your own conscience. I remember when Dr. Farooq Udwadia left JJ Hospital, at his farewell he told us that from tomorrow I won't be here to ask you why you did this and why you did not do that. You start asking yourself, you are responsible for your own conscience. I realized that is so important. And I think if you did that, then the motto was cure if possible, but care always. And the earlier generation knew that cure is not possible many times, but care always. And I think this made a patient satisfied, grateful, faith in the doctor, compliance of treatment, because the doctor treated body and mind both. And I'm sure if I see a pediatrician's child, he has many questions to ask me. But when a layman comes to me, he doesn't know what he should ask me, so I even don't tell him anything. I think the mind is so important, and when you do all that, there is a divine healing. Healing is a natural process. When you get a fracture, there is no treatment. You just don't move the arm, and then the nature heals. So the divine healing needs the doctors to follow all this kind of holistic care. But what has happened today? Shortcut to history and physical examination. Some of you may have read the books that Dr. Groupman has written about how doctors do and his own experience of that. How doctors think. How doctors think about the patient. Several case scenarios. Ultimately, the conclusion of his book is doctors don't think. And this is in Boston, in the era of 2000 to 2005, recently. And in Boston, he thinks that the doctors don't think. It's not we only who don't think. The entire world's doctors don't think. And I think therefore there is a shortcut, we call it MISS approach, MISS, management first. If he doesn't get well, investigate. Even investigation don't tell you and he is not all right, then ask him, Baba zhalay kai tula, what is your symptom and signs? And then earlier there was an experience-based diagnosis. Today we have to have an evidence-based. Therefore we use art of possibility. Earlier it was art of probability. What is possible? Anything is possible. As we sit here, this may collapse, possible. No, but this is the best place in Thane, it won't collapse. But that's your thinking. So, possibility. And I think therefore we have to do maximum tests and drugs. I remember at Jaslok I was asked by an adult neurologist to see a child whom he had admitted. This child, 8-10-year-old, came back from school and complained of headache. They straight away took him to a neurologist. And the neurologist examined and said, no, why do you come? He said, no, but in our family there was a brain tumor once, so it's better you do a CT scan. And the CT scan showed the tumor. The tumor was not the cause of headache, but it showed the tumor. So he admitted, and he wanted to prove that he was not the only fool, but even I was the fool. So he said, sir, he is a small child, would you look at him? I went and saw otherwise normal looking child. I asked them, Alat kashala? They said, see the CT scan. And I remember that mother even today. She told me, sir, whatever your experience, but moment somebody says headache, do a CT scan. She told me that. And I had to accept it. Okay, though I don't practice it. That she doesn't know. But I don't know whether next time I'll meet the same thing again. The point I'm making is that therefore maximum test, even the parents want it today. And the funny thing is that they want the drugs, but when somebody gives too many drugs, they are also worried about that. So I think that is how it is. And therefore, today we treat the disease, not the human being. You have not understood what that person goes through when he has a disease, and you and me know very well. So that part I think we are thinking. Of course, we have no time for counseling and documenting, and I think we are after cure but without care. And I think that is what is likely to be bothering about it. And then what's the result? Dissatisfied, suspecting patient. Today when he comes, he said, how is this doctor going to loot me? If he's asking for CT scan, does he get a cut? Now he's thinking all the time about that. There is no mutual faith. There are often arguments. The resultant rudeness, even you become rude. There is a fear of legal suits. So I want to have everything proved. You may die, but you must die with a normal report in your hand. I don't care. But I should be safe. And I think we have a defensive practice. This has become a vicious circle. And I think it's not we have changed, even the community has changed. And we must take a note of that. But we are the sufferers when the community has changed. I think they have outsourced health management. Sir, एकदा तुमच्या हातात दिलं ना, आमची काळजी नाही. अरे माझ्या हातात काय, तुझ्या हातातच मूल आहे ना. I am going to guide you. I am not going to treat your child. But they seem to feel we are paying you, no? You better do it. Tomorrow they might ask you, you come and stay with us, you look after, you take your charge. Okay? Because outsourcing. After all, today when you put a tuition to your child, you expect that teacher to see that he gets good marks. As if the teacher is responsible. Here the doctors are responsible. And while when the parents neglect the rest of it, they neglect the lifestyle. But still you have to make them well. They expect too much, unrealistic expectation, a quick fix, cure a must as early as possible, and at low or no cost. Okay, expect free advice, 24 hours, free advice. Okay, this is what the community wants. They have a lack of faith at the end of all that. There is a doctor shopping secretly, hiding information, poor compliance, expect privileges but not responsibility. When a patient comes late to my clinic, he said, nahi traffic hota, मी udun आलो का? I also come in the same traffic. Okay, but I wait for you. And he said, but you know the child is sick, you must understand. Now if you think you understand sickness, you must come in time. You don't understand he is sick. You want me to understand he is sick, so you are coming late. What a thing. I am sure all of you have seen this again and again. Therefore, there is an increasing demand of investigation. मी म्हटलं ना टायफॉइड वाटतंय सर वाटतंय नको प्रूव्ह करा आता if the culture come negative then he proves me wrong. I have to tell him Baba culture may be negative, your lab is not good, but that's not his problem. That's black and white. He has a belief in test reports. He expects drugs for every symptom. I remember Anand Shandile used to always tell me this, that when a patient comes, he has only 1 day of fever, but he had 20 complaints. Sir, kaal ratri zhopla nahi. Okay, he has a little cold. He coughed also once, he vomited. And sir, my husband does not look at this. He goes to the office and my maid also has not come. No, he said, what is the chief complaint? Okay, so they want advice for everything. And I think when you give too many drugs, they are worried about. They say, Aajkal doctors, they write too many drugs and too many tests. If tests come negative, they wonder, why did you do a test? But before doing a test, they want a test. So I think the community is also at fault. And then they are cribbing about cost of health. After all that, okay, when they go to a restaurant, they pay whatever the bill is. Okay, but here they say, itka daisa. Many times you must have seen, when 2 children come, they want to know whether there is a concession. I said, what is this? If 2 people eat in the restaurant, you get a concession? No, you don't. So I think this is what they expect. They judge us by outcome. Incurable disease also, if you can't cure, then you are wrong. Many times I heard somebody, one of my own colleague, he was telling me that his father was not well. He had old age problem all the time, flatulence, constipation. When I went to visit him, the father told me, no, my son does not look after me. I said, no, why? He is looking after you. He said, no, I have told him की एक चांगला डॉक्टर पोटाचा मुंबईतला आणून दाखव की. तर माझा मुलगा म्हणतो चांगला डॉक्टर पोटाचा मुंबईत नाही आहे, मोठ्या पोटाचे पुष्कळ आहेत, चालतील का. आता दिस फादर सेड काय मस्करी करतो माझी. व्हॉट आय मीन इज दॅट दे एक्सपेक्ट सम क्युअर अँड ऑल दॅट, अँड आय थिंक therefore what is happening is we are judged by only the outcome. We are blamed if the outcome is bad. Then there is the fights and violence and all that. And I think I will just end up by saying there has to be a way forward. We need to introspect and change proactively. Forget the community, they will not improve. But let us improve ourselves. And I think let us not turn profession into business. That is important. What is business? You make money at any cost. But what is a profession? You make money, but giving the best advice to them so that they don't come back sickness. We also make money. There's nothing wrong in making money. You make a lot of money. But while you make a lot of money, you give a lot of benefit to somebody who is paying the money. And I think that's the profession. Patients don't care how much you know. Luckily, I never got a medal. So I could not write on my letterhead gold medalist at MD. Okay. But when I don't write, they possibly think I may have many medals, and how many medals I write. So there is an advantage of not writing. If you have one gold medal, please don't write. You are saying you got only one medal. People may mistake me that I may have many. So I think the point is, they don't care how much you know, but they want to know how much you care. And how do you demonstrate you care? You talk to them empathetically, and I think that is where you treat the body and the mind. You have to balance between quantity and quality. I think in Mumbai the taxi can take only 4, not because the 5th cannot sit, but there are enough taxis and there is enough safety. I think we must learn to kind of control our quantity so that the quality doesn't get. And I think I have been very lucky to have a group practice. Today we have 4, and every 10 years we have added. We have really been most happy doing that. Okay. And I think keep updated, of course. Okay. And follow art combined rational practice. What is art combined? Be empathetic. Talk to them as if your own child is suffering, and what would be you think or your wife think about it. A little cough also they worry about, and think about it. And I think that turns into patient satisfaction, and most important, a doctor gets blessed. Blessing is not available anywhere outside, even by payment. And this is the only time that you get blessed. And what does it do? It promotes self-nurture. Your health remains well. You remain healthy and happy in life, free of stress. And I think that is most important for all of us. Friends, don't believe me, but it is a fact. Success lies in happiness. When somebody says, sir, you are successful, that is their impression. But if I am happy, they don't know, but that's my impression. Happiness is what I feel. Success is what others talk about. Who is bothered about others? You are bothered about yourself. And I think therefore, I heard one of the Ramakrishna Mission disciple who is a surgeon. He left his surgery and devoted his time to Ramakrishna Mission. He once told me that, sir, happiness is the only cause of unhappiness in life. I said, I've been trying to tell everybody you must be happy. He said, no, but there has to be a limit of that. I said, what do you mean by that? If he says the person who had no job got a clerical job, he was happy. But very soon he was unhappy because he wanted to be a head clerk. Once he became a head clerk, he thought he was happy. He wanted to be a manager. So he said, let happiness be not pursued. Let happiness come easily to you. And that was his message. Well, friends, I talk about the way I thought of it. I'm sure there are many exaggerations, but exaggerations are important. Sometimes you frighten a parent. If you don't follow this, you may get into trouble. it works. I thought that is the way I look at it. Once again, thank you very much, both of you and the organizing team for doing that. Thank you.
Thank you, sir. That was a wonderful talk. So please have a seat. I request Dr. Parmanand, sir, to felicitate.
Hello, yeah. Yeah, thank you, sir. Thank you very much. And wonderful points, I mean, for life, not just for practice. And thank you so much for all those things. And we really realize that happiness is in our hands and not anybody else's hands. It's fabulous. Thank you so much. I now invite our... Yes.
Sir, please have a seat. I request Dr. Grivita to felicitate Dr. Suhas Kulkarni, sir, and Dr. Parmanand, sir. Also. Sir, please.